So now let's proceed to the common problems or ailments in the endocrine system. So when we say common problems or ailments, so we can relate it to the disorders or the diseases in the endocrine systems. So what are the endocrine disorders? So these are diseases related to the endocrine glands of the body. Most common endocrine disorders are related to improper functioning of the pancreas and the pituitary, thyroid, and the adrenal glands. These disorders often have widespread symptoms, affect multiple parts of the body, and can range in severity from mild to very severe. So what are these disorders? So the first one is the diabetes. The diabetes mellitus is the most common endocrine disorder and occurs when the pancreas either does not produce sufficient insulin or the body cannot use the available insulin. So the symptoms of both type 1 and type 2 diabetes includes excessive thirst or hunger, fatigue, frequent urination, nausea, and vomiting. Also, an unexplained weight loss or gain. And the last one is a division changes. The next disorder is the acromegaly. It is a disorder in which the pituitary gland overproduces growth hormones, and this leads to symptoms of overgrowth, especially of the hands and feet. Symptoms of acromegaly include the abnormally large lips, nose, or tongue, also abnormally large or swollen hands or feet, and altered facial bone structure, body and joint aches, deep voice, fatigue and weakness, also headaches, also overgrowth of bone and cartilage and thickening of the skin, also sexual dysfunction including decreased libido, also sleep apnea, and also the last one is the vision impairment. The next one is the Addison's disease. So this disease is characterized by decreased production of cortisol and aldosterone due to the adrenal gland damage. And the common symptoms of Addison's diseases include depression, diarrhea, fatigue, headache, also hyperpigmentation of the skin or it has a bronze appearance, and also hypoglycemia, which has low blood glucose, loss of appetite, also low blood pressure or hypotension, missed menstrual periods, nausea, with or without vomiting, also salt cravings, also unexplained weight loss, and the last one is weakness or loss of strength. The next syndrome is the Cushing's syndrome. So this syndrome arises from excess cortisol produced by the adrenal glands, and the symptoms of this Cushing syndromes include buffalo hump, skin discoloration such as bruising, fatigue, feeling very thirsty, thinning and weakening of the bones, and also frequent urination, high blood sugar, high blood pressure, and the irritability and mood changes. The next one is the Graves' disease. So this Graves' disease is a type of hyperthyroidism resulting in excessive thyroid hormone production. So the common symptoms of the Graves' disease include bulging eyes, diarrhea, difficulty sleeping, fatigue and weakness, goiter, heat intolerance, irregular heart rate, irritability and mood changes, rapid heart rate, thick or red skin on the shins, tremors, and also the unexplained weight loss. Next is the Hashimoto's thyroiditis. So the Hashimoto's thyroiditis or the autoimmune thyroiditis is a condition in which the thyroid is targeted by the immune system, leading to hypothyroidism and low production of thyroid hormone. So often Hashimoto's thyroiditis is symptomless, but symptoms can include cold intolerance, constipation, dry hair and loss of hair, fatigue, goiter, joint and muscle pain, missed menstrual periods, slowed heart rate, and also the weight gain. The next one is the hyperthyroidism. So this hyperthyroidism is a condition characterized by an overactive thyroid gland. So, the common symptoms of the hyperthyroidism include diarrhea, difficulty in sleeping, fatigue, goiter, heat intolerance, irritability, and mood changes, rapid heart rate, tremors, and also the unexplained weight loss. So after hyperthyroidism, so we have the hypothyroidism. So this hypothyroidism, it is a condition in which the thyroid is underactive and produce too little thyroid hormone. So often hypothyroidism can be symptomless or very mild. So the common symptoms of the hypothyroidism include cold intolerance, constipation, decreased sweat production, dry hair, fatigue, goiter, joint and muscle pain, menstrual periods, slowed heart rate, swollen face, and also the unexplained weight gain. The last one is we have this prolactinoma. So this prolactinoma arises when a dysfunctional pituitary gland makes exist prolactin hormones, so which functions in the production of breast milk. So excess prolactin can lead to symptoms such as erectile dysfunction, infertility, loss of libido, menstrual periods, unexplained milk productions. So what are the risk factors for endocrine disorders? So a number of factors increase the risk of developing endocrine disorders, but not all people with risk factors will develop endocrine disorders. So these are some risk factors for endocrine disorders, which includes the elevated cholesterol levels, family history of endocrine disorder, inactivity, personal history of autoimmune disorders such as diabetes, poor diet, pregnancy, in cases such as hyperthyroidism. Also, the last one is the recent surgery, trauma, infection, or serious injury. So how can we reduce our risk of having this endocrine disorders? So while many endocrine disorders are inherited or arise for unknown reasons, some may be related to modifiable lifestyle factors. So you may be able to lower your risk of certain endocrine disorders such as hypothyroidism by eating a balanced and healthy diet. So living a healthy lifestyle including regular physical activity. So how are endocrine disorders be treated? So in many cases, endocrine disorders may be symptomless or mild enough to not require treatment. So symptoms can arise from excess hormone production or a hormone deficiency. So when symptoms of endocrine disorders are bothersome, they can generally be treated by correcting the hormone imbalance. So this often done by means of a synthetic hormone administration. So in cases such as, for example, the prolactinoma, so where a non-cancerous tumor is responsible for symptoms, so surgery or radiation therapy may be used. So often diagnosis and treatment of the underlying cause of the endocrine disorder will resolve the symptoms. So that's all for the common problems or ailments in the endocrine system. So thank you for listening. God bless.